morning and welcome back to Keep Moving with the Senior Center. I'm Amy Beck, the Director of Senior Services in Hopkinton. Wow, what can I say? This has been a really busy month for us. So much has changed since we sent out our May newsletter. I know that some of the things that you may have seen in our newsletter don't hold true right now. And so today I've got Sean McAuliffe from the Health Department here to kind of give us an update and explain a few things. But before we get to that, just to let you know, the long and short of it, the Senior Center is open. We are bringing programs back, our regular activities back slowly. And a lot of it will depend on our teachers and how we move through the building. So if you have any questions, feel free to give the Senior Center a call, 508-497-9730. And as a reminder, our building is open Monday through Thursday, 8:30 to 4, and Fridays, 8:30 to 2. And if you have any questions, like I said, about what's back and what's not, and can we bring back and all of that, give us a call and we can fill you in as to where we are. But it is coming back, and it kind of took us by surprise. It's a little bit sooner than we thought. So as a reminder, the Senior Center will be closed on Friday, June 18th. And let's go from there. So Sean, good morning. How are you?
Morning.
Fantastic. You know, I always start with a question of the week, and I don't have one today, but I guess basically, you know, are you ready for summer?
We're getting ready. It's kind of to build upon your statement about being caught by surprise. You know, I had laid out an entire plan for the summer because we didn't think that this day or, you know, last week's announcement or the week before's announcement was going to come until mid to late August. So I was I was caught off guard as much as anybody else was. And it's kind of representative of what we went through, you know, over the last, 14 to 16 months, where the state was changing things without really giving us any warning. But to that point, we're in a really good spot, as a community and now as a Commonwealth. I mean, I was looking at the data last night, and our positivity rate in town is down at, I think, 0.24, which is fantastic. Our vaccination rates across the board, from 12-year-olds to, I think our oldest resident is about 105. We're approaching 90% for every age group. And then on our second doses, I think over 60% of the population has received their second dose. So, wow. We have very little illness. We have a really high vaccination rate, and we see the same conditions all around Hopkinton. So, and then to that point throughout the Commonwealth, and that's why the governor's task force thought it was okay to move forward quicker.
Yeah, we were following your guidance. We were ready, gearing up for August, and thinking by then we'll have things back. And but that's good. I mean, yeah. We're glad to be back. We're glad to have things opening up here. Having more activities here and having more in-person stuff. But along with what he said, the governor had said is, and maybe we can speak to this a little bit, is we know that because of the vaccination rate, all these things have changed. But when do we need to wear masks? What are the regulations? Are there any social distancing requirements anymore? Where are we? What should we really say we can do?
So in essence, the only group, there are two groups that should be wearing masks. It's those, or really, actually, it's one. It's those that aren't vaccinated. And so the 11-year-olds and under are not vaccinated. And then we have an unvaccinated adult population, a small one, but it's there. So, to those that are unvaccinated, they should be wearing masks, um, because although the pandemic is we're not seeing the effects. There are infected people. I mean, Carnival Cruise just sailed out of I don't know where, and they already have 2 positive people on the cruise ship. So there are people out there that are ill, and we have these variants that are better at spreading. They're easier to transmit. They multiply faster in your body when you catch them. So, if you're not vaccinated, you want to be careful. I have friends they just were sent to Tennessee for work, and they've got a really low vaccination rate. So I said, even though you're vaccinated, you might want to wear a face covering when you're out in public, like in some of the larger events that are part of this conference, because you don't want to be bringing it back. She's got 2 little kids at home,
Right.
and we've seen several, actually, at least 9 people in town have actually contracted COVID, and when they've been fully vaccinated. The good thing is that those 9 individuals were either completely asymptomatic or had one lost their sense of smell. So that's demonstrating that even with some of the variants that they've caught, they've got fantastic outcomes. The vaccine's working. But
Right.
so we want to wear a face covering if we're in a large group. I'm going to a concert in September, but I'll be wearing a face covering. And one of the things that we're going to look at is whether or not wearing a face covering might be advisable, going into cold and flu season. I mean, we had almost no flu in town, and very low rates of respiratory illness. In the schools, we had virtually no norovirus. So there's an argument to be had that wearing a face covering and distancing is just good for your general health. And now we're just trying to figure out how do we build some guidance on that. And we're in the process of hiring a new nurse, and we're going to put together guidance for the community, for different age groups on when we might want to consider wearing a face covering, even though it's not required, but just as a matter of continuing these trends on low rates of respiratory illness.
Well, and I have to say, that I agree with you. There are places that I'll still wear a mask if I'm in a crowded area, and it's great, to not always have it on. I love that fact. But the long and short is then if you're unvaccinated, you should still be wearing a mask. And if you are vaccinated and you want to wear a mask, nothing's holding you back from doing that. And and I will say, I remember talking with my mother recently about this. She lived in Japan back in the mid 1950s, and she was shocked that on public transit they all wore masks. And so this is not a new thing, and it's not an odd thing. And I know that got politicized, but I think like you're saying, if it makes it easier in the winter seasons and it drops down cold, flu, other situations, then that's not a bad thing. So
right. And like the kind of one of the funny things was just recently at the vaccine clinic, we're hosting one of the health directors was sneezing, and he's like, "Oh, my allergies are killing me." And I said, "Put on your mask." He's got a really bad pollen allergy, and he went about the rest of the day. He had part of his duties were outside, and he comes back inside. And he's like, "I feel so much better that I'm wearing a mask," because it was filtering out the pollens that were causing him problems earlier. So there is an argument for wearing masks. I mean, I went out and bought 4 new ones just recently, and I just carry them with me in my car, and I still wear a mask when I go if I go grocery shopping, anywhere where there's a large crowd, Home Depot, because just that the rate is, it's about, I think what the rate of infection. But, if you're in a facility that's got 100, 200, 300 people shopping, there's a chance that someone in there could be infected. And, if you know anything about my history, you want to be prepared for that really off chance. And so.
So the question then is, if now I know some people can't get vaccinated for medical reasons or religious reasons or whatever, and that's fine. But if people want to get vaccinations, are they still able to? I know we've had a regional clinic. What's the opportunities and where are we with that?
So we're going to operate our regional clinic through the 22nd of June. And then we're going to take a pause because none of the health directors, none of the public safety staff. I mean, the fire department, they've been sending me volunteers, virtually every day. And we've been working together, every day for 16 months. So we're going to take some time, and we're waiting for the state to put together the next plan. We're not going to completely close the clinic. We're mothballing the physical premises, and we're keeping our ability to order vaccine en masse open. And then what we think we're going to do is we're going to start placing orders and then spreading the vaccine out to the 7 communities that are working at this clinic. And either Casey or my new nurse will have vaccine on hand. Actually, even the fire department will have vaccine on hand, and we'll be able to vaccinate people. And we're just figuring out, all right, do we go to the old sign up system that Casey used to have? We just got to figure out those mechanisms. So we'll be able to do it. I believe CVS will still be doing it. And the state is telling us that they're going to be pushing it out to many of the primary care physicians. So it'll still be available on a smaller scale, more local scale. And we encourage people, if you haven't got vaccinated, please consider it, because we just had a case in town where someone who was convinced that they weren't at risk, they knew, they were kind of like me, they knew too much, and they thought they were invincible. And they were, I would argue that if it wasn't for Casey being as stubborn and convincing as she can be, she used a few choice words to get the guy off the couch, and the hospital said that this individual was hours away from being intubated, and this individual has a good sized family, and it would have been and was otherwise in really great health. So you just don't know. And that's the kind of the terrible thing about this virus, is you just don't know how it's going to affect you. So if you haven't, please consider it, and we can help facilitate access to vaccine.
And so should they call the health department? What's the best way to about?
Yeah, they can call the health department. And I know we'll have vaccine here at the fire department. We'll have it Northborough, Westborough, and I think Ashland will have it. And we're talking about, we might be able to put some of our vaccine into deep freeze through a partnership that Ashland has. So again, that's one of the meetings that I have today.
Well, good. So again, if you want to get vaccinated, you still can. Call the health department if you need help with it. You can reach out to the senior center, and we're happy to help whatever we can. And just so you know, also, don't let transportation hold you up from getting the vaccine. We have received a wonderful grant in Hopkinton, and this transportation will get you to medical appointments. It will help you get to vaccinations. It will even take you shopping. So call the senior center if you're needing transportation. And then on a side note, I will let you know that our buses are starting to go to the grocery stores again. So again, you know, we're getting fully operational. The only thing with buses, whether you're vaccinated or not, you're still wearing a mask. So if you don't have any, or you threw them out because you said, hallelujah, I'm done, we will have masks that we can share with you in this situation like that. But again, if you want help with transportation or vaccinations, give us a call. If you have any questions, the health department's a great resource as far as what vaccination and how to go about it. And your clinic is through the 22nd, you said, of this month.
And we've been sending, you know, paramedics out, Casey and a paramedic, like we've been sending people out for the last 3 months to people's homes. So if, you know, if your options at the senior center aren't working, or if for some reason you're medically homebound, we'll find a solution. You know, and you know, although Casey is resigned,
which I won't even go there. That is, I totally understand, but we're very sad. But I'm glad she's still staying connected.
No, I mean, and she's going to continue to work for us. But she's going to be vaccinating people through the 27th.
Right.
So, and then when she's back in town, we're gonna, you know, we're trying to figure out, and we know that we have the opportunity to do both flu and COVID vaccines together now. So we're trying to figure out how to, you know, when to roll out those joint clinics, you know, there's a lot of planning that's, and we have all the equipment right now. We can host both outdoor enclosed clinics. There are a whole bunch of opportunities. So if you want it, you know, we're here to provide a vaccine.
Excellent. And now we're into summer and the heat. So any guidance or reminders for us how to handle the heat? Well, besides hydrate, right?
Right. You know, and I'm terrible at hydrating, but you know, and possibly, you know, I got my coffee here, but that's not doing me any good.
That's not really doing it.
No. But you know, it's funny because we're finding, and just anecdotally hearing, that people have kind of forgotten that you know, they've got to be, you know, careful and conscious about staying hydrated. You know, I was looking at our tick bite records, and we haven't had any, you know, I'm going to jinx myself, but we haven't had any tick-borne illness in about a year. So, but, you know, we know that dog ticks are out in force right now. We had a 2-week period where at one of the schools, you know, they're pulling at least 1 to 2 ticks off of children every day. So it's important to stay hydrated, sunscreen. Now, if you're out golfing or gardening, you know, there are easy steps you can take to protect yourself from ticks. You know, mosquitoes are going to be a bit of a problem this year. So, you know, we're going to run programming like we had in the past on tick prevention, but I just encourage people to go out and if you're able to get out to like a Home Depot, they sell permethrin, and you can spray your shoes. And if the ticks, you know, they got to climb on your shoes 9 out of 10 times to get up on your body. So if you've just sprayed your shoes with permethrin, it'll kill the ticks on your shoes. And there are a lot of people out there that don't like bug spray. But if your concern is using bug spray to get rid of ticks, just spray from your knee down, because that's their entry point onto your body. So you don't have to spray it all over your body. Just get your knees down. For golfers that hit in the rough,
Like
it's not.
myself?
And yeah, because I had a resident who was bedridden for 3 weeks. Thought they had no idea what they had, and and we recommended that they just consider taking a look to see if they had a tick bite. And it turns out that they had babesiosis, which is like tick malaria. And after like 3 days of medication, they were up and running around and able to go golfing again. But you just want to be careful, because just kind of like the virus, you don't know what, if you get a tick bite, you don't know what the tick's carrying. And then we're still sending ticks off to get tested if anybody does get bitten. So we can send that off, just so you have that. Actually, you and your physician can have that knowledge about what the tick was carrying, and you can take precautions accordingly, with the results in hand.
And then I think you may have hit on it, but the Triple E situation so far, we're good in town. Are they spraying?
So yeah, so what we've done is we're working off our 2020 plan. So we went out and what they call larvicided. So I know a couple of weeks ago, residents were calling in that there were low-flying helicopters. What they were doing is they were releasing an organic fungus into the water bodies that are known to carry West Nile virus and Triple E virus in Hopkinton. So the fungus feeds on mosquito larvae, and it's otherwise harmless. And so that was released in an effort to try to keep our mosquito counts down. And if we kept them down from the spring season to the summer season, we have a better chance at seeing low numbers as we move into July and August. We're monitoring more areas in town. We currently have, or historically, we've had 12 monitoring sites. So starting this week, I go in every week, actually today, to review the previous week's catch counts, the species that are present, because there are only certain species that tend to bite humans, and the species, there are only really 2 species in Hopkinton that we tend to be concerned with. And they bite both the birds that carry either West Nile or Triple E and humans. So I monitor those counts. We monitor whether or not any of the mosquitoes trapped out of those pools contain the virus. And then the DPH, the mosquito control program, and I work to put together, strategies to control those mosquitoes.
But
And
at
then,
this point, we're good.
yeah, at this point we're good. But it's just, remember to, if you're going outside, it's just a good thing to long sleeves when it's cool out, and using bug spray again. You just want to protect yourself.
And get rid of standing water in your yard, right?
Yes. It's
With all that rain we had a couple weeks ago, all of a sudden I realized things are filled up. You got to dump that out and get rid of that. So
no, and that's I mean, I just had to do that myself, and I'm undergoing a bathroom renovation, and I have an old tub that's sitting in my front yard, and I got to get the tub out, because the tub is a problem itself, and I got someone picking it up today. So it's just going around and just identifying, if you have potting, like plant holders, just that's all the mosquitoes are really looking for, to get a hold and start breeding. So And then it's really just, right now it's just, with all of, these risks that we've been talking about, it's key just to get outside and enjoy the outside and really take this time to really unwind, because it's been a really difficult year. And for everybody's kind of mental health, it's important just to get out and start relaxing and socializing, to just kind of unwind yourself from all of that stress. And I would argue that there's a lot of heartache, loneliness. We want to start kind of getting ourselves back, doing it smartly, but getting ourselves back, to improve our overall mental health.
No, well, Sean, thank you. Like I said, it's a great news to hear where we are.
Yeah.
And we want to continue in that direction. And all of the stuff that you've shared today is so important. Again, if you're unvaccinated, please continue to wear those masks. That is the rule.
Right.
And don't feel bad if you still want to wear that mask when you're in public. That's your right. And it's not that odd. And some of us will continue to do it in larger public forums anyway. I do love being able to go on a hiking trail and not have to worry about taking a mask,
Right.
but it is okay to have it. And then continue to be smart, keep hydrated throughout the heat. If you are having troubles with your air conditioning or you need some help because you are getting too hot. I know today's a beautiful day out. I haven't made it outside other than from the house to the car, but I'm looking forward to later. These are all common sense things, but if you are in need of any assistance, feel free to give the Senior Center a call. Keep checking your newsletter, keep checking websites, Facebooks for the Senior Center, because we do update that information. And, we continue to be here. We've been here for you for the last year, for the last 30 years, and we are still here. So, stay in touch. Again, you can reach the Senior Center at 508-497-9730. And Sean, as always, I appreciate your coming on. You share a lot of really good information. If you have any questions about anything Sean has said, or you're concerned about the mosquitoes or any of these other topics, feel free to give the health department a call. They can give you some really updated information and advice on that. So as always, stay safe, stay cool, enjoy your summer, get outside. Like Sean says, it is so important, and see those friends. We're finally able to do it.
Yeah.
And I know I can't wait to have a party at my house. So anyway, take care, everyone. Have a great week. Sean, again, thank you very much.
Thank you for having me.